The decision to now offer a third shot came on the heels of recommendations from other stringent health authorities, which suggested that the immunity provided by the 2 doses of the COVID-19 vaccines, or 1 dose in the case of the Johnson & Johnson vaccine, diminishes after 6 months. Minister of Health Dr. Frank Anthony said during Friday's COVID-19 update.
Therefore, if the immunity starts to wane, the chances are that persons can get infected, they can be breakthrough infections, and the protection that the vaccine would normally offer for persons, preventing them from getting a severe form of the infection, that can start to wane.
The minister added that the 3rd doses will be accessible to persons 50 years and older, as well as persons affected by underlying conditions at vaccination sites throughout the country beginning next week.
So 50 years and above, you would be eligible for a booster dose once that 6 months would have passed since your 2nd dose of a 2-dose regimen. So that's one category of people. The second category of persons, if you are below ages 50 but up to ages 18 and you have some form of comorbidity, then you can get a booster shot.
Persons with comorbid conditions include cancer patients, those affected by chronic lung and kidney diseases, HIV patients, patients suffering from heart conditions, expectant women, those suffering from diabetes, among others. Persons administered with the single-dose Johnson & Johnson vaccine will be eligible for a booster shot 52 days after being immunized, the minister informed. For the 3rd shot, persons can choose to be administered the same vaccine they previously got or request a different brand.
So if you had 2 doses of Pfizer, you can get a 3rd dose of Pfizer. With some people, they would like to have mix and matching. So if you had 2 doses of AstraZeneca, some people might want to have 1 dose Pfizer. So we'll put out that schedule of possibilities.
Meanwhile, the immunization of children ages 5 to 11, which was initially slated to commence on Friday, has been delayed. Dr. Anthony explained that the delay is due to unsuccessful efforts by the ministry to acquire the specialized vials from Pfizer in time for the vaccination rollout for children.
And therefore, we'll have to defer that until we get those special doses that Pfizer would have made, the prepackaged doses. And once we get that, we'll be able to roll out the vaccination for children between 11 to 5.
Temika Rodney reporting for the HGP Nightly News.